Good evening. You're listening to Fresh Air Community Radio KFAI 90.3 FM in Minneapolis, and we're streaming online at kfai.org. And this is Health Notes from the Hearts of a Natural Woman, and I'm Kinshasha. This evening on Health Notes, we're going to be in the first half hour talking about the Farm Bill. There's a lot to be learned about it as it relates to especially food stamps, poor folks. Really, really important information. So do stay tuned, kfai.org, or call 612 375 9030. We are talking with Carolina Snyder. Carolina is a registered dietitian known as Carolina the Green, and she says that the Farm Bill's Supplemental Nutrition Assistance Program, otherwise known as SNAP and formerly known as food stamps, provides vital assistance to millions of disadvantaged Americans to ensure that all people have access to nutritious food. However, there's some crucial nutritional gaps that demand attention from Congress that voters can elevate to advocate for an updated farm bill to improve SNAP and enhance the program's quality and nutritional offerings for all Americans. Good evening, Carolina. How are you?
Hi, Kinshasa. Thank you so much for having me. I'm doing well. How are you?
I'm good. I'm just wondering, in terms of this particular issue, how did this, how long have you been doing this work and why is this important to you?
It's been a couple of years that I became involved with the SNAP program, working back in Florida, where I used to live, with SNAP beneficiaries and families, giving nutrition education, which we all know is so important in the U.S. I mean, all over the world, but especially here, where we do have such a gap in knowledge when it comes to what we should be eating to support our health and the health of our families. I'm excited to talk to you today because the Farm Bill gets revised every 5 years, and it's coming up for revision at the end of this year. This is a really timely matter to talk about.
What's true with the Farm Bill right now?
So the Farm Bill, just to give a little context, it includes provisions for nutrition assistance programs such as SNAP, as you mentioned earlier, what we used to call food stamps. So changes in the funding, the eligibility criteria, or the structure of the program, within the Farm Bill will have direct implications on the SNAP program and, as a consequence, how much access Americans have to nutritious foods, and food security. As a registered dietitian working with SNAP, being involved with this, I believe that it's so important that we address any gaps in the nutrition or the offerings that come along with SNAP, so that, since we are only renewing this Farm Bill every 5 years, it's important that we make the program as, comprehensive as we can to give nutrition access to everyone. So, one thing that I think it's great about SNAP is that it provides access to all foods. People can buy very nutritious foods like fruits, vegetables, whole grains, nuts and seeds. But one thing that many people don't know is that SNAP also allows beneficiaries to purchase what we call junk food. You can go to a gas station, a convenience store, and purchase candy bars and chips. Unfortunately, that's usually what people go for, right? It's the tasty food. It's inexpensive. So one thing that I believe SNAP could improve is to have more strict guidelines to help people choose the foods based on the quality and the nutritional value, and that's where nutrition education comes in, so importantly.
So, with the exception, you're absolutely right in terms of the junk food, but is the current Farm Bill and the current SNAP guidelines effective and just need to be strengthened, or are there a lot of things that need to be added in order for it to make SNAP a more effective program?
Yeah, that's a great question. There actually are things that we could include into SNAP that are not currently a part of it. One thing being vitamin supplementation. So, as a dietitian, I'm the first one to say, hey, let's get our nutrients from food first, right? Food is priority. Unfortunately, I know that in practice, this doesn't always work. Not most, about 40% of our population are deficient in vitamin D. We're spending time indoors, we're working from home, we're simply not eating enough vitamin D food sources, and we really can't eat our way to proper vitamin D levels because the sources of food are not great. So, one thing that the SNAP program could improve is giving access to, vitamin supplementation as part of a benefit, that people have that choice to purchase supplements if they need to. In particular, vitamin D, which is not only so crucial for our health and protecting us from disease, but it is a vitamin that most of us are deficient in the U.S. And, year after year, I see this as a registered dietitian. And it would be great just to give people the option. When you go to your doctor and you say, hey, you're borderline low in vitamin D, or you are deficient in vitamin D, if Americans could use their SNAP benefits to purchase that vitamin, which actually wouldn't cost the program anything else. It would be a pretty easy addition to the program. That's one thing I think we're truly lacking, and that could really bridge the gap in nutrition of so many Americans that are currently deficient in this important vitamin.
What would it require on the part of Congress to make that addition?
Yeah, so I think the first thing is knowing that this is an issue, right? So I think Congress is interested in what we're interested in. Hopefully, they're representing us and our interests. So I think the first step is making our voices known, that dietary supplements such as vitamin D is extremely important. And as a dietitian, I feel like it is my job also, and other health professionals, to spread this message. And that's why we're here today. Part of it is to let Congress know that this is an issue. It would be an easy addition to the program, and it would really make a difference in people's health. Because imagine if you are struggling to put food on the table each month, are you going to spend your small budget or your benefit? I mean, not your benefits. Would you spend your budget on a vitamin D supplementation, or would you buy food for your family, right? Majority of the people will prioritize food, as they should. So adding the vitamin D as something they can purchase through SNAP would be a game changer. So, to answer your question, just letting Congress know is the first step. And this is why it's important that we contact our Congress representatives locally, and I can let your listeners know how to do that in a second. But that's really the first step, and hopefully, it's something that they will understand the urgency and the importance, and fight for it as well.
In case you're just tuning in, we're talking about the SNAP program and which was previously called the Food Stamp Program and the Farm Bill. And we're talking with Carolina Snyder. She's an incredible dietitian who has an amazing Instagram page, by the way. And we're talking about the Farm Bill that's coming up. And the Farm Bill comes up every 5 years. And certainly, in case you just tuned in, one important thing that Carolina talked about was the importance of supplementation being included into SNAP, so that folks especially could start with vitamin D3. Can you explain to our listeners the difference between vitamin D and vitamin D3?
Absolutely. So we have two types of vitamins. Vitamin D2 is usually what we find in plants. And it's not as readily used by our body, meaning it's not as effective or well produced and absorbed in our body as is vitamin D3, which is more effective in raising vitamin D levels in your blood. Is the more active form of vitamin D, and that's usually found in animal products. If you're talking about diet, but as a supplementation, we're usually looking at vitamin D3 as the superior version. And now, if you're not consuming animal products and you're listening today, there are vitamin D3 supplements that are vegan, that are not from animals. So it's readily available. It's just a matter of people who are unfortunately disadvantaged when it comes to their economical status and their financial means, having the choice to use benefits, government benefits, to purchase vitamin D is so important, because as we said earlier, it's not something that people will prioritize. People want to have access to food first. So I think this is why it's so crucial that we get that hopefully into the Farm Bill this year.
I certainly hope that that's true. Whether we're talking about good food or good supplements here in the Twin Cities, in Minneapolis in particular, but in the Twin Cities in general, we probably have more food co-ops than probably most cities do. We not only do we have a lot of food co-ops, but we also have Whole Foods and places like that. I guess the first question is, can people use their SNAP benefits there?
Yes, that is a great question. I'm glad you brought this up. So actually, I was surprised to learn how many places people can use their SNAP benefits, including local independent grocery stores and natural product stores, which I'm a huge fan of, because they usually prioritize locally sourced produce. So, locally grown fruits and vegetables, local brands, even for other products, food and beverage products. And they are usually more health conscious. So yes, with your SNAP benefits, you can actually just go to the USDA website to see where you can use it, or you can actually just type on Google natural grocers directory, an infra store directory, and you can find all these independent retailers near you, and natural stores that, provide such great, nutritious food options. And you're also supporting the local economy and local farmers, which I think is amazing. So, people do have access to these. It's important that, you're prioritizing wholesome foods. And like we said earlier, SNAP unfortunately also allows people to buy non-nutritious foods, the more processed foods. So shopping at, local independent grocers is such a great way to make sure you're getting the most bang for your buck when it comes to nutrition and, healthy foods.
So the Farm Bill is going to come up before the year's end is over?
Yes, correct. So it just got extended to the end of the year, and that's why I'm hoping we can all kind of speak to our local Congress representative. And people may be wondering, well, how do I do that? Which actually I didn't know either how easy it was. But there's this amazing nonprofit organization. They're called Organic and Natural Health Association. They did all the work for us. They've written a letter to Congress explaining exactly why, we're proposing to add vitamin D supplementation into SNAP. What are the benefits and why this is so important, considering so many of us are deficient. And really all you have to do is go to allforvitamind.org. And that's the number 4, allforvitamind.org. Click on the tab that says Take Action, put in your first name, your zip code, and it will auto-populate the letter and send to your local Congress based on your zip code. So that's pretty neat. It takes about 2 to 3 minutes, and it's one way that we can speak up. You're asking me earlier, how can we get this into the Farm Bill? I think this is the first step. The more people we can get to take action and send a letter to Congress, hopefully they'll see this is a pretty important and urgent matter.
I'm wondering as we're moving towards a change in the Farm Bill, and I certainly hope that lots of signatures come in and people request things which will hopefully make this current Congress actually get something done. In the meantime, I'm wondering what kinds of things can current SNAP folks do to create a healthier lifestyle with what they're able to get with their current SNAP benefits?
Yes, excellent question. So we know we talked about the local independent grocers already. They can shop there to prioritize more, wholesome and local produce. But in general, just prioritizing whole foods. These are foods that come in their natural form, and minimizing packaged or highly processed foods. That's a great first step. One thing I like to recommend to people is to buy frozen fruits and vegetables as well, because they're inexpensive and they last longer. So they're a great option to have in case you don't have access to fresh produce, or, just as another option, a plan B to have in your home. And then, when it comes to the vitamin D supplementation, making sure that you're getting your blood work done at least once a year with your physician. Get your blood vitamin D levels checked. See if you are in need for a supplement. And if you are, while we wait for this to hopefully pass with Congress, you can take advantage of coupon codes, or manufacturer discounts for vitamin D supplements, and, get your hands on those for now so you can address this, nutrient deficiency if you have it, because unfortunately it is it's pretty harmful in the long term to have a low vitamin D levels, and it's associated with a myriad of chronic diseases. So that's a few things people can do. And then, hopefully we can get this passed, and they will have at least the option to purchase vitamin D if they need it.
Why is buying locally superior to for so when we're talking about these natural food product stores, we're generally talking about stores that seem to prioritize local produce and local farmers. Why is that important in terms of nutrition?
Yeah. So a few reasons. First, usually if you're purchasing local from local farmers, there's less travel time from when the fruit or vegetable is harvested to when it makes it to your plate, or your grocery store, right? So that minimizes transit time. So that's not only great for the environment because we're minimizing transportation and, gas emissions, but from a nutritional standpoint, that food is more nutritious because it's fresher. It's been harvested for, shorter time, versus if you're purchasing, let's say strawberries off season at a grocery store, chances are it's coming from the other side of the country. It's traveled for many days, and now it's been in contact with the oxygen, and that lowers the nutritional value of the food. So every day that goes by, your food gets less and less nutritious. It doesn't, because fruits and vegetables are so nutritious to start with, it's not a huge deal. So I'm not saying, your food at the grocery store is not nutritious at all, but the closer we can get to the source, the more nutritious that food is going to be. And as a consequence, you're also supporting local farmers, local economies, and, the environment, of course.
One thing that you've continued to talk about the importance of vitamin D3 as it relates to our mental and physical health. And unfortunately, when you're talking about the SNAP program and other programs like that, we're talking about large numbers of Black and brown people. How does low vitamin D levels affect people of color?
hmm So actually, people of color are less absorb or produce vitamin D less efficiently because of the melanin in your body. So we have what's called a melanin blocking vitamin D absorption that happens, with your concentration of melanin in your blood, which determines your skin color. So yes, people of color are more susceptible to chronic conditions associated with vitamin D deficiency because of that. And another thing is as well, we know we can get vitamin D from the sun, but that's an issue if you can't produce enough vitamin D in your body, even if you're exposed to sun. Another thing is that we're not really exposed to sun to start with. It's impractical. We're being told to stay indoors. We're being told to wear sunscreen because of the implications of too much sun exposure. So, regardless, we are, as a whole, we are not getting enough sun exposure and therefore not producing enough vitamin D. And then we also have populations that have intestinal or gastrointestinal conditions that prevent that absorption and production of vitamin D as well. And then finally, we have people like me who don't consume animal products, let's say. So I am already at a higher risk for vitamin D deficiency because the food sources that contain vitamin D are mostly all animal sources. So there's so many reasons why people are currently vitamin D deficient, and why this is an issue.
Didn't you say that there have been new sources of D3 that are not animal sourced?
Yeah, absolutely. So we have vegan D3. They're made from, so usually a D3 supplement is made from sheep's wool, and then there's lichen. It's a vegan friendly source. So you can get vitamin D now from different sources that are not coming from an animal, which is great because, like myself, I don't consume animal sources of food. So for my vitamin D3, I will choose a vegan option as well. So yeah, it's pretty easy to find out. So lichen comes from either a fungus or an algae. So these are pretty unique sources, but if you're looking online and you type vitamin D3 supplement vegan, you will find many sources. And luckily, I'm finding that they're less and less expensive as the years go by, as more competition comes around for brands. It's more accessible, which is great.
There was something that you said earlier, Carolina, in terms of the ability for people to buy packaged foods and sugary foods that fit into the paradigm of I don't know what you would call the food cartel with their fat, salt, and sugar formula in terms of keeping people hooked into. I mean, back in the day, it used to just be called packaged food. Today, it's called ultra packaged food, which is pretty scary. Any thoughts on what we can do to move out of the trap that has been created for not only folks on SNAP, but for the general public in terms of our addiction to fat, salt, and sugar, and generally in packaged foods especially?
Absolutely. I think the first step is eating more at home, because when you're cooking your own food, you're less likely to use the crazy amounts of oil and sugar and salt that junk food stores or fast food chains use, right, that are addicting. In fact, especially in the US, we have a huge problem with that. So that's the first step, cooking your foods at home. They're going to be naturally less saturated with oils, additives, flavors, artificial flavors, etc. So that kind of trains your taste buds to get used to this more simple food. And another thing to do is when you are, shopping for foods, try to stay on the outer parts of the grocery store. The inside aisles are usually the ones that contain ultra processed packaged foods. So if you think about when you walk into a grocery store, usually at the end, either left or right, you have your produce section. You have your fruits, your vegetables, you have your bulk nuts, and you have, like even in your frozen section, you have a whole frozen fruit and vegetable sections now. So try to focus on those and prioritize, these real foods, the single ingredient foods is what we say. So think about an apple. It's only one ingredient. It's an apple. But if you're buying apple juice, it's probably sugar and colorings, etc. So try to stay as close to the origin and the source as much as you can. And that's the best thing you can do for your health, and to kind of retrain your taste buds to love real foods and kind of steer clear from the highly processed items.
Any suggestions in terms of the addiction that we have to sugary drinks and weaning ourselves off of that and drinking more water and other nutritious drinks so that we're not only eating well, but drinking well is drinking well too?
Yeah. So, I think luckily now we have many, many alternatives to sugary drinks that don't contain sugar, but still have that flavor or that sweetness. They're usually artificially sweetened, which in this case, I would argue it's a better option. Usually I don't love artificial sweeteners, to be very honest. I like to stay as natural as I can. But when it comes to sugar sweetened beverages, it is such a huge problem in the US. And you are right, people are absolutely addicted to it. It is a condition. I've worked a lot with this in the past. And telling people to cut it off, it's not realistic. To say, hey, starting tomorrow, you should only drink water. That's not realistic, because like I said earlier, your taste buds adjust to that level of sweetness. So now there are all these alternative, soda beverages that are not sweetened with sugar. They're based with water, carbonated water, some natural flavors. Sometimes they are sweetened with things like stevia, etc. But they do kind of fulfill that need without the harmful health consequences. Again, this is just a way to bridge that transition. Not saying that you should go crazy on these, artificial sugars and sugar alcohols by any means, but it is one realistic way to ease into drinking more water, and maybe like carbonated water with flavors versus, sugar sweetened beverages like soda.
Excellent. Can you one last time give us the address that we can go to so that we can send to our congressperson the information as far as our support of adding supplements to the farm bill?
Yes, certainly. So all you have to do is go to all four, and that's the number 4, vitamind.org, all4vitamind.org. This is a website with the Organic and Natural Health Association. There is a tab on the top that says Take Action. You click there and you would just walk you through the steps. It takes about 2 to 3 minutes. You just put in your information, your zip code. The letter will auto-populate and you just press send. So it's very easy, and you should get a response from your local Congress representative, saying they received the letter. And, it varies from state to state. But I know in Minnesota where you're at, we have about over 400,000 residents that rely on SNAP. So, even if it doesn't affect you directly, it affects a lot of people around you. That's about 1 in 13 Minnesota residents. So it's still a great number. It's very easy, all4vitamind.org. And, we appreciate everyone who can help, and hopefully we can get this passed through Congress.
Fantastic. We've been talking with Carolina Schneider, incredible dietitian and obvious advocate for everybody being able to get healthy food. Thank you so much, Carolyn, for your work and for this conversation. It's been great.
Thank you so much. It's been such a pleasure, and I appreciate you hosting this platform and having me and help me spread the word. So thank you so much.
Bye bye.